loading the kids in the car, brokering peace in the back seat, mastering the snack handoff without even looking. Why are simple things sometimes so complicated? Thankfully, with auto owners, insurance doesn't have to be one of them. We work with independent agents who live in your community, know you by name, and answer when you call. They keep insurance simple, so you can worry about more important things, like figuring out what's growing in that cup holder. That's simple human sense. Ask your independent agent if auto owners make sense for you.
Welcome, friends. This is your place. It's the Dare to Ask podcast, Season 3, Episode 3. We deal with everything.
We like fixing things.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
From the multiple diseases that are managed in internal medicine, staying up to date on research, delivering exceptional patient care, all the way to being a part of a welcoming atmosphere in our healthcare system. The list goes on and on. When I get a chance to sit down with Dr. Anna in this We Deal with Everything episode on internal medicine, what was so fascinating was getting personal and how her goal every day is to have a work-life balance. We can hear the fire in her voice over some really exciting things that are happening with weight loss medications and diabetic patients. That's just one area that she's really fired up about. But it's also really fun to do a deep dive into the story behind how a little farm girl from Puerto Rico who wanted to be a vet became a doctor and practicing medicine here in North Dakota. She has a beautiful name, and I'm going to need her to help me with it. So let's get to it.
My name is Jaramillo. It's a long name. I work at Essentia Health, South University Clinic. I'm an internal medicine board-certified physician.
When you say your name, it's like a song. It's so beautiful.
Thank you.
Now, how would you like me to say your name?
So you can just call me Anna. It's like with one N only.
Mm-hmm. Anna.
Like
okay. And what do your patients call you?
Some of them call me Dr. Anna. Some of them, if they're more well-versed in Hispanic pronunciation, they can call me Dr. Jaramillo. Mm-hmm. But it all depends how comfortable they are.
Yeah. How do you like living and working in Fargo?
Something new to me because I'm originally from Puerto Rico, born and raised there, trained, then went to Florida to do my internal medicine residency, went over the extreme to the cold weather.
Yes, we're talking culture and weather alone. You've found about the most extreme.
Yeah, but so far I'm tolerating it well. I just do a lot of layers.
Yes.
And just ask my coworkers on what to do and what not to do.
And it doesn't matter where you're transplanted and where you're put. You're going to deal with that no matter what.
That's true.
You can always put on more layers. If you're hot, there's only so naked you can be.
I'm well aware.
Dr. Anna, I'm so excited that you have joined us. I want to know about you. You're from Puerto Rico. Mm-hmm. Tell me your family dynamic.
I was born and raised in a small town called Sabana Grande, which literally means big sheet.
Big sheet.
Yeah, that's how you translate it. It's a very small town. A lot of the locals kind of know about it and some don't. So it's a smaller town than Fargo. So I was born and raised there in a farm.
Holler to the farm girls in the room.
So I initially wanted to be a vet. Being exposed to farm animals and everything like that. But then eventually with school, I got exposed to science and anatomy and diseases. So that interested me more. Regarding my family-wise, I was born and raised with my mom, dad, and my brother. He's like 2 years younger than me.
Okay.
Side note, my mom is from South America and my dad is from the mainland Puerto Rico. So I also was born and raised with like different cultures.
Yes.
And delicious food.
Oh, man. I was just going to say, the food you grew up with has to be next level.
Yeah, I miss it.
I'm salivating right now.
I know. Oh, okay. After that, I went to train in college in Puerto Rico. That was like 3.5 years. Then I did med school in Puerto Rico as well. That was 4 years. And then after that, it was the main thing, the training for 3 years.
Sure.
I know. It's a lot.
It is a lot. You doctors, the education that just never ends.
It never ends.
Does it ever end?
No, it doesn't ever end because you need to take your boards and then you need to recertify every like 10 years or so. But in between, you need to keep updated with everything that's changing, basically.
Yeah. Take me to Puerto Rico with little Anna. Be a vet, but you're exposed now in schooling. You decide medicine interests you a little bit. What was the day-to-day? What was the expectation in your family?
Earliest thing was like me being 4 years old. That's the earliest thing that I remember. So, but I just woke up and my mom would have breakfast ready, like a little arepas, which is like corn, plantains, with a little cheese and egg. So good. So I would eat and do my chores, like help my mom in the kitchen, help her feed the animals, and kind of visit, my grandma and everything. Because in Hispanic culture, maybe in your culture too, everyone lives close by. So they're visiting each other and talking.
All the time.
All the time.
Now, when I was growing up, both sets of grandparents living very closely. Second nature to have just relatives at the coffee table, enjoying coffee, a little bit of breakfast, that same thing. Parallels in our cultures.
Yeah.
And what did you call your grandma?
My mother's side, I called her by her first name because my cousin, she used to call her like that, and she's the eldest one. So we kind of learned from that. So from my mom's side, her name is Ana Rosa, which means Anna, and Rosa is like flowers. So hence that's my first name.
I was just going to say, okay.
So I would call her Anna.
Okay.
Yeah.
Not Grandma Anna or Abuela. No. Okay.
It was
just
unusual. But my grandfather will call him Abuelo. So yeah. From my dad's side, I would just call her Mama and then Olga, which is her first name. It's because, again, my sister and cousins, they're older, so we kind of learned from that.
British royalty. What is the heir doing? Oh, the heir's doing it this way? Okay.
Let's all do it the same, literally.
Let's all do it the same.
Yeah.
Okay. I like that you were named after your grandma, too.
Yeah.
That makes my heart smile. Early days. What kind of animals?
Because we lived in a farm, we had a lot. We had horses. We had more horses when my dad was younger. People that used to come and help with the horses as well. We used to go horseback riding in the farm. A lot of dogs. Initially, we had beagles, and then we changed to Doberman initially.
Oh, wow.
After that. And then we used to have birds. Around that time, it was legal to sell macaws, those from South America. We have those. She's still alive, though. So.
Oh, wow. That's so cool.
And cats and rabbits, chickens, et cetera, et cetera.
Farm life. We have one of this rando animal that's just part of the group. It's just whatever.
Yeah.
Cattle was the majority of what my family and my mom and dad still raised. 250 Black Angus. So,
wow.
Side note on my life, farm life there. How was it to move? Because it's not just the culture that you know, also all the family.
Yeah, it was a little bit hard at the beginning, but Florida wasn't that bad because I have like aunts and other family members there, and I was able to get the ingredients for the food more easily than here. So it wasn't really that hard because you're too busy working, and when you get vacations, of course, you visit your family or plan a big trip with them to somewhere exciting. So I was too busy to miss them. Yeah. Let's put it that way.
What year was it that you had moved to Florida?
It was around 2019.
That's really not that long.
No.
Oh, you sweet little transplant up here in the Northland now. Tell me the spark that happened in medicine when you're like, I'm going to be a doctor.
Because I was doing 50-50. Do I want to be a vet? Do I want to be like a doctor of people? So it was around junior high school that I really decided, I think I like to do this more than taking care of animals because I found it very interesting and how the body worked. And of course, with people, you can create relationships like deeper than, of course, with animals.
Yeah.
And I was interested in it. And then after that, I was like, okay, for sure, I'm going to medical school.
Usually somewhere along the lines in med school is when you start to go, okay, here's home.
Some people go in and they already know what they want. Again, I'm always not sure. Hence 50-50. I wanted to be either a obstetrician gynecologist versus internal medicine because I liked everything, but I also liked women's health as well. So it was around the second or third year when you're exposed to those like real life rotations.
Yeah.
that I was like, okay, so let's try and do internal med because I'm not completely sure if I like one thing. And with internal medicine, you can deal with everything.
I'm starting to see a theme in your life here.
Yeah.
Like a little bit of indecisiveness.
Yeah, so hence I'm here. Yeah.
Go into internal medicine. And generally speaking, what do you do in internal medicine? Because there's a lot.
A lot, yeah. So the simplest version is we deal with patients that are at least 18 or older, both male and female. From the multiple diseases that we manage, the most common ones are high blood pressure, cholesterol, diabetes. We also manage some women's health and mood disorders as well. But that's the surface.
And those are growing so much too, specifically in women's. Hormones and mood disorders, and it's just like ever expanding.
Exactly.
And the evolution is just continues.
It's changing all the time, so you don't get bored.
Is there any of those changes that you're excited to see?
So what we're seeing a lot is, I think you've probably heard about it, weight loss medications and everything. Initially, they were just used for diabetic patients, but they had a side effect that caused weight loss. Why? Because they decrease your appetite, impair how your body clears your food, and then they're approving it more for weight loss now, and they're also trying to approve it for younger patients too.
Gotcha. So what is that age range? Down to 18, down to 16,
so
or even younger?
I think even younger. The last article I read, I think it was Ozempic, this fabulous one. They were trying to get like younger in their teens, like probably 15s or so. But that's still on work. It's not officially cleared for that yet. But
And this is exciting because it's an epidemic, the obesity in this country.
Yeah, it is. It is. And some people, sadly, they fail on what we call lifestyle modifications like diet and exercise.
How many something else's does it usually take before you are seeing patients and able to help them in this area specifically?
So it depends. They need to have at least a trial of a few months or so and that you see that they're compliant with it. So let's say if ideally, I use like a 3-month or 6-month trial just to check and see how they're doing. If they don't really work with that, we'll try and use pills or injectables, then going more aggressive on surgery that people sometimes are scared of.
The option that there is something.
Yeah.
Because right now it's like, okay, lifestyle modification or massive intervention, like surgery. So to have something in between as even options to, like you said, try it and see if there's something there. I'm excited to hear that it's becoming more pediatric. This is a sad reality that we have right now.
Yeah, that's what they're seeing. Like before, we used to see usually older people like in their 20s becoming obese, but now it's even children and they're diagnosing them with diabetes even early on.
Yeah.
So that's a problem.
And with diabetes being one of the areas in which that you see on a daily basis.
Yeah.
And weight management is such a huge play in that. Chicken and an egg almost?
Yeah.
Like which came first, if
exactly.
you will? Or
so they go hand in hand. If you lose weight, your diabetes were probably more controlled. If you gain weight, it's going to be uncontrolled. You need a balance.
Yeah, personal life. What does that look like for you? Especially like going into college, relationships, and then, let's move across the country.
Thankfully, like my mom and my brother, they come and visit me all the time. Currently, he's staying with me right now.
Wow, fun.
Yeah, so I'm not alone, but at least we get to see each other most of the time and travel. Like I have an upcoming trip that I'm going to plan with them to Europe.
Oh my goodness.
So we're just going to get some break from, patient care and recharge.
Yeah.
Yeah.
How important is that for you?
It's a lot. It's much important because if you feel that you're worn out and tired, I think you won't be able to focus as you should. So I think it's ideal to have a work-life balance. That's the important thing.
Something that I always ask, nuggets that you are able to pass along, even if it doesn't involve your area of expertise.
So for my own personal health, I try to get at least 8 hours of sleep if I can. Sometimes you can't, but ideally most of the time. And again, the work-life balance is ideal. You only live once, and I don't want to be in my 60s and look back. I was like, I should have done all of these cool things when I was younger. Do a little bit at a time and not overwork yourself.
Yeah. It is such a hard balance because you don't know where your brain and your heart is going to be at your feelings of what you did with your life, the legacy you leave behind when you're 80, right? So you might be like, why didn't I do this more? But then the devil's advocate in that would go, but you became a doctor.
Exactly.
All those hours and years, you have this to show for. What do you see for your future, especially personally, because you have been so family oriented? Is that important to you?
Yeah. Yeah, that's really important because I just freshly graduated from residency. I still have a lot of things to do. Yeah. First of all, I would like to travel more because in residency you can, but it's not that you can travel to longer distances, different countries that are too far off, like Asia or Europe. Also, I would like to buy a house eventually. Regarding children-wise, I'm still not quite sure. I'm still young. I'm just going to enjoy my life at the moment, and then eventually I can think about it.
I don't want to be like your mom here and already Anna, where's the kids? I want grandkids. It always seems to be the case when it comes to parents. They ask that question, and I'm assuming that that's popped up. What is the dating scene for a young doctor in Fargo?
Okay, so dating scene wise, because you're professionals, it wouldn't be ideal to use the dating app. What if that's your patient or something, or somebody else sees your profile? Yeah. Fargo is a small place.
You're right.
Nobody knows each other. So dating wise, I think it would be ideal just to go out to different places and see, because that professionalism sadly gets affected because you're a doctor.
That is a good point. I hadn't even considered that.
If you were another profession, they wouldn't say anything about it. But if you're a doctor, I saw my doctor's dating profile.
HIPAA, darn it.
Yeah.
Where is good? Because I don't know if you've noticed this or not in the short time that you've lived up here. Social gatherings that include bars and that sort of thing seem to be one of the only places that people say, I've heard, now I've been married forever, so I don't really know, but that this would be the place to go and meet. Now, are you opposed to that, or does that kind of whatever?
I'm not really opposed to anything. It depends. If you're looking for someone at a bar versus looking for something else, I won't make judgment, but if it happens and you have chemistry with that person, then give it a try.
Who cares where you met him,
Yeah,
right?
exactly.
Yeah. Nobody wants the beginning of the love story to go, and I met him at a bar, or I met her at a bar. But no judgment.
Yeah,
where we
no
meet
judgment.
the right person, that, who cares? Forget meeting anybody, but just going and doing pastimes that you like to do.
I plan not that much ahead. Again, if I'm going to a trip that I need appropriate planning, I'm crazy for it. I do an itinerary and everything. But if it's something short term, like on a weekend, I usually plan it 1 or 2 days before. I like to try new things, but skiing is not one of them. I was born and raised in a tropical island. I'm not coordinated for that.
Have you tried it yet?
No. If I do, they told me there's a little slope that they...
Bunny hop.
Yeah, that I'll try that first. I can't fracture my bones and miss work for that, but I'll give it a try. I can try that.
One of the intentions that I've laid out for myself this year is to be curious in movement. However movement comes about, and if I'm going to be active, I like to be active in a controlled environment, like inside in the gym, and not so much outside. But I am opening myself up to the possibilities. Anyway, having to bait a hook or squish worm or a little tiny minnow, that really grosses me out. It's not for me.
But give it a try and see. At least you can say that you did it once. Right. And if you didn't like it, then that's fine. At least you tried it.
Yes.
Yeah.
My brother and his wife, they had enlisted the no thank you bite in their household. Always you at least have to try. And if it's I never want to try that again, then it's no. Thank you. But you tried it. So I'm trying to take a little bit of that and apply it to my curiosity and movement for this year. Is there anything like that you want to try?
Well, yeah, because I just recently moved here. I haven't had time to try all of those interesting things. But once I'm more settled and everything I'm willing to try, they talked about, I have one of my friends here that she's a hospitalist. She moved to this area. She tried going to the shooting range. That's something I would like to try.
Yes.
So I have a few lists of to-dos that I'll try soon.
The more outside time you can get, especially in this vitamin D deficient climate, just even those few minutes a day where the sun can touch our face. My therapist says it's good, so I'm going for it.
That's true. That's important. Okay, I'll put it on my to-do list then.
Your ever-growing long to-do list.
Yeah.
Look at it this way. We are really getting close to warm weather. Been in Fargo for how long?
Officially moved here around September.
Lakes country.
Yeah.
It's not the tropic atmosphere that maybe you would be missing, but I hope somebody invites you to their lake so you can do some of those fun things.
That's true. If I could just rent a cabin that has a lake, that would be another option.
Yeah. Friends,
exactly.
Just keep asking, making, and accepting the invitations when they come. Let's talk a little bit more internal medicine. Specifically, what are the areas that like you feel more and more like you love to work with people? And is there any specific areas where you're like, okay, maybe it is diabetes or something like that?
So the interesting thing is that patients present with very non-specific symptoms that can be multiple things. So that's why history is very important, labs if needed, and the physical exam that can give you those clues. But sometimes patient would like to have one answer. Sometimes it can happen or sometimes it can't. It can be more than one. Regarding particularly a specific area that I enjoy, it's really hard to pick one. I enjoy different things. Like let's say if I haven't seen a mood disorder like in a while and I see them again, okay, this is interesting. I haven't seen this type of, let's say, depression or anxiety. Let's treat this. Or heart diseases that I haven't seen. So it's not a particular thing that I pick preferences. As you can see already, I like everything. So it's kind of hard to pick.
Especially for where you're at in your career, just in the beginning, how you'll feel in a decade or 2 decades. There might be a whole other thing that has yet to be uncovered.
That's
you
true.
get to be a part of that. I can only imagine how exciting that might be. Fixing things. Clearly, you like to find the problem, find how to get at it, find an answer.
Yeah.
You're a fixer?
Yeah. Cannot speak to everyone that went into medicine, but we like fixing things and we get uneasy when we can't fix it. There's some things that you can try your best, maybe not fix it completely, but improve it. So it's not only in medicine, it's just in everything, like my health and all those things, which I like to keep them stable.
Sure.
Yeah.
In all things, stability.
Exactly.
It goes back to balance.
Yeah.
What we started at
true.
the beginning of all of this. How often do your parents or have they come up and visited you yet?
My mom has visited me one time and she's coming again in a few weeks just to visit. So my dad is afraid of airplanes, so he won't. Probably when I have another vacation, I'll visit him or try and convince him to go to some therapy and relaxation exercises before getting on a plane. But yeah.
Okay, nice. And your brother is here now?
Yeah, my brother's here now.
So what are the things that you and your brother do then? What are you introducing him to?
So when he first came in, he had a list because he likes planning too. So he did a little list of things that he wanted to check out. I took him to the downtown area where you have like a lot of like ice cream shops, stores, and restaurants. We have a few places to go. He was also interested on Viking Museum, or what is it called? It's in Minnesota. That is really close by. I forgot that one.
So that is the Jomkamp Center.
Exactly.
Okay. An impressive Viking ship is in there. And a really great story to go along with it. So I do recommend you should go and check that out. Outside, and it's not related to the ship at all, but same energy, they have recreated like a Stav church outside, and it is so beautiful. And there's a lot of interesting history. And
then he'll be interested on everything in Fargo. Initially, he was like, what's there to do in Fargo?
Well, we ask ourselves that almost every day. But we find things. Any kind of wisdom that you want to impart?
Maybe like if you think that something's wrong with your body, just don't hesitate and, try and see your doctor and try to discuss with them what you think it's wrong. Again, a lot of people have biases that their doctors don't listen. Again, I don't really know their experiences.
Right.
But try to find one that's willing to listen and try to help address your issues.
Especially at Essentia, I've had such really phenomenal luck with virtually every single provider I've seen, whether it's been like from the primary level to OBs and my midwife and everything in between, and pediatrics and so on. But communication and how easy it is now to communicate with your provider, your MyChart and whatnot, and just like firing off a little message. I wake up really insanely early in the morning, and usually that's my time where my brain starts operating, and the millions of things that I had on my mind the night before, that's when I get it all out. So I will be that patient that will send the message at 2:30 a.m., not in any kind of expectation that I'm going to get it back in 5 minutes, but just like, okay, it's out, it's done. I can cross that off my list. And when I hear back, It's great.
That's true. The earlier, the better.
Yeah. Thank you so much for your time. And I can't wait to see you out and about in Fargo and getting more and more acclimated. Best of luck.
Thank you. Thank you for having me.
Dr. Anna is just fun to be around. She's one of those people that I just want to keep asking about where she comes from and her personal views on things. Oh, and something about she's kind of an incredible doctor of internal medicine. I get a little attached to my guests here. And I'm really looking forward to next week, too, when we're going to go into the deep end on diet and nutrition. Don't miss it on the next Dare to Ask podcast.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
Education, innovation, community, impact. That's what you'll experience as a student at the Chicago School, an accredited nonprofit leader in higher education for nearly 45 years. Choose from programs in psychology, health, business, counseling, or behavioral sciences. Learn from expert practitioner faculty and immerse yourself in a solutions-oriented approach to education that can prepare you to positively influence the health of individuals, organizations, and communities. Learn more at thechicagoschool.edu. That's thechicagoschool.edu.